Thank you so much for that introduction. I'm so excited to be joining you all this evening to present this session, Advocacy in Action, Empowering Voices to Transform Ovarian Cancer Care. So we'll be looking at the pivotal role of patient and caregiver advocacy in shaping health systems and enhancing ovarian cancer care. I will provide real life examples and to illustrate the impact of collective advocacy and just how important the patient voice is in our work. So the goal of this session is to really explore how patient and caregiver insights shape our efforts and how we communicate advocacy related information with our community. We share collaborative success stories and highlight both upcoming and ongoing advocacy initiatives. So first, I want to take us back to 2016 when OCC set out to increase research funding for ovarian cancer by raising our visibility with government and decision makers. So we started by working with researchers and clinicians to really build a national research plan. Then we took it to Parliament Hill, as seen in the photos in the bottom right of the slide, meeting MPs, hosting events, and mobilizing our community to write letters, sign petitions, and really make their voices heard. It took 4 years of persistence, but in 2019, we secured $10 million in federal funding for research, and we were able to leverage that into another 4.6 million from provinces, Nova Scotia and Saskatchewan, and other research organizations. You can see a photo on the slide with the Premier of Saskatchewan in the top right of the slide, and on the top left and middle photo, those are from a lab tour in Nova Scotia with Federal Minister Francois-Philippe Champagne. So as the first 5 years of our agreement came to an end, we built on that success with an expanded plan to really keep the momentum going. So this wasn't easy. We had new ministers, the pandemic, and shifting priorities. But we persevered and we secured new funding through the federal government's Strategic Science Fund, or SSF. Then we focused on the next step, which was working to secure additional funding from the provinces. Before I move on to the province-specific funding examples, I just want to make clear, kind of following some of the examples I've already spoken about, like the lab tours, meeting with MPs, hosting events where we meet with government in a variety of ways. And over the past year and a half, OCC has had 43 meetings and presentations with elected officials from the Government of Canada, 9 provincial and 1 territorial government, including a premier and the ministers of health, leadership from 4 cancer agencies, family doctors, nurse practitioners, and registered nurses from 12 professional associations, raising awareness on the critical role of ovarian cancer prevention, the importance of biomarker testing for cancer patients, and the responsibilities that government, primary care providers, and cancer organizations have. So we are constantly engaging with decision makers. And later in this session, you'll hear about examples where those engagements resulted in real positive change. So moving now to the province-specific examples for research funding. So as I just mentioned, Nova Scotia and Saskatchewan were the first provinces to support OCC's national research efforts. In Saskatchewan, working hand in hand with our Teal sisters, as you can see in the many photos on the slide of their amazing work and involvement, we advocated directly to the Premier and Ministers of Health, and secured an additional $1 million for ovarian cancer research projects in the province. So this brought their total to $2 million. In Nova Scotia, we continue to work closely with local researchers, patients, and government to ensure research funding extends beyond the initial commitment. And we're pleased that elected officials remain engaged, from attending the Lady Ball and Walk of Hope to most recently, in May 2025, joining a tour of Dr. Jeanette Boudreau's lab. The Honorable Michelle Thompson, Minister of Health and Wellness, attended that tour alongside OCC CEO and a patient advocate whose leadership was key to making it happen, all pictured in the photos on the right side of the slide. Our advocacy in Nova Scotia is ongoing as we work to turn continued support into a lasting research investment. In 2022, OCC, together with researchers and clinicians, we set our sights on securing an investment from Manitoba. We organized lab tours and meetings with the Minister of Health in 2023, but following that year's election, we needed to reintroduce ovarian cancer priorities to the new government in order to really keep that momentum going and that pressure on. In October 2024, OCC presented at an all-party cancer caucus in Winnipeg, again, alongside researchers, clinicians, and advocates. And among the attendees was the Honorable Uzoma Asagwara, who's the Deputy Premier and Minister of Health, Seniors, and Long-Term Care, who engaged directly with OCC. So you can see a photo of them at the podium on the slide. We followed up with a ministerial briefing, and in February 2025, we hosted a lab tour showcasing the research of the Manitoba Ovarian Cancer Research Group and discussing the potential for a provincial center of excellence. That same month, we submitted a provincial budget request for a $1 million investment. And on September 8th, 2025, at the Winnipeg Walk of Hope, Minister Asagwara announced Manitoba's $1 million investment in OCC's research initiative. So this success, along with wins at the federal level and in other provinces, it really does show the power of researchers, clinicians, and advocates coming together to engage government and drive meaningful change. Now I'm going to shift to health systems advocacy. So health systems advocacy means identifying and addressing gaps in the healthcare system that affect our community. We often learn about these gaps through conversations at the Walk of Hope, TLTs, of dialogue, support calls, or even through media stories. These insights help us piece together where the system is falling short. And then once a gap is identified, we consult with experts, so researchers, clinicians, patients, and cancer agencies to determine what should be prioritized and what solutions may work. So these solutions can include policy changes, improved clinical practices, or increasing access to specialists. And from there, we take action. So changing the health system is complex and it's slow moving, but as a patient organization, our role is to really raise awareness, bring issues to the attention of politicians and decision makers, and show that people are demanding change. Sometimes we also work in coalition when the issues affect multiple groups, but I'll be covering more on that a bit later in the session. So the key message is you are essential to this work. By sharing your stories, asking questions, and engaging on off dialogue or through our programs, you help shape our advocacy. And we are listening. And in the next few slides, I'll share real examples of how your voices have already made an impact and such a difference. So one of Ovarian Cancer Canada's biggest advocacy efforts is ensuring ovarian cancer drugs available outside of Canada become accessible here too. We gather input from patients and caregivers, often through of dialogue where experiences are shared, interviews are requested, and surveys are posted for participation. And we use your insights to influence decision makers. Patient and caregiver voices are critical to our patient submissions, and they have real impact. So here are just three recent examples. The first is Keytruda. So in a partnership with another patient organization, we brought the ovarian cancer perspective to Canada's Drug Agency, or the CDA, and an S, the equivalent of the CDA in Quebec. In February 2025, CDA recommended Keytruda be publicly reimbursed with conditions for patients with microsatellite instability high, or MSIH, ovarian cancer. So this brings the drug one step closer to being accessible in Canada. Next is Mekinist, or tremetinib. In January 2025, as a person with lived experience, Luda was invited to present at the Formulary Management Expert Committee, or FMEC, which is a Canada's drug agency advisory body, about her experience with the drug tremetinib. The presentation to the FMEC marked an important step in acknowledging the value of lived experience in drug reimbursement reviews, and Luda's voice really, grounded in the reality of what it means to live with ovarian cancer, added a vital human perspective. The committee recommended public reimbursement, which was a positive outcome, and provinces are now negotiating pricing. And finally, ELAHERE, so sometimes referred to as MIRV. ELAHERE is approved in the US, and for platinum-resistant ovarian cancer, and has shown significant survival benefits. To support its approval in Canada, we developed and shared a patient submission with input from over 50 patients and caregivers to Canada's drug agency and INESS. Health Canada has approved ELAHERE, and Canada's drug agency has issued their draft recommendation to reimburse with conditions. The process is still ongoing, but this was a major step forward, and we know that including the patient and caregiver perspective contributed directly to this positive recommendation. So as I mentioned earlier, INESS, which serves as Quebec's equivalent to Canada's drug agency, this means that when we prepare a patient submission for a new drug, we submit one to INESS and one to the CDA. For those of you living in Quebec, we want to let you know that INESS's review process has been taking longer than usual. So for example, CDA has already issued its draft recommendation for ELAHERE, but we're still waiting for INESS to release theirs. This delay is on our radar as we want to ensure that patients in Quebec have timely access to new treatments, just like those in the rest of Canada. And we continue to closely monitor the situation and really remain actively engaged with our partners and other patient organizations to address this issue. Our drug access advocacy work is powered by you. These wins were only possible because of patient and caregiver involvement. Your stories really make a difference, and your voices are what's moving the system forward. So once again, let's go back, but this time to 2022. At that time, PEI was the only province or territory in Canada that hadn't listed PARP inhibitors, so Lynparza and Zejula, on its drug formulary. These are standard of care treatments for ovarian cancer, and we spent 2 years advocating, writing letters, emailing, calling political offices, partnering with the Society of Gynecologic Oncology of Canada, submitting a formal brief through a public consultation. And despite our efforts at that time, we saw little movement. But this changed at the walk in Charlottetown. Members of the opposition party were in attendance, and when they saw Teal sisters walking together and when they heard firsthand from the community, it really moved them. That moment opened the door to new, more productive meetings. And thanks to a combined effort, on December 13th, 2022, Canada's Minister of Health and PEI's Minister of Health announced that PARP inhibitors would be added to the provincial formulary effective December 28th. So you can see a photo on the slide of Ovarian Cancer Canada's CEO also making remarks at that announcement. It was the power of community, really showing up, speaking out, that created this impactful change. And we were persistent, we were visible, and that really made the difference. So just thinking of when you attend the walk and you speak to invited politicians, know that you can drive real change. Your presence, your voice, they matter. And wins like this are, again, proof that the system does change because of you. Next, let's look at gynecological cancer care expansion in British Columbia. So also in 2022, a Teal sister highlighted an article about an ovarian cancer patient who faced long delays to diagnosis and treatment, really exposing gaps in BC's health system. And we heard from patients during Teal Teas. OCC began engaging with clinicians, patients, and the BC Ministry of Health to address these challenges, focusing on the impact of the gynecologic oncologist shortage in the province on ovarian cancer patients, particularly for those living outside of the Lower Mainland. And on July 19th, 2024, BC's Minister of Health announced a plan to establish new gynecologic oncology services in Kelowna and Surrey, expansions in Vancouver and Victoria, doubling surgical treatment centers from 2 to 4, and increasing oncologists from 8 to 15. Since this announcement, the Kelowna program launched in September 2024, and by December, 3 new surgeons had joined. Since its start, 82 patients have received timely surgical care, with the new suite expected to serve nearly 300 women annually who previously had to travel long distances. This expansion is a major win for patients outside the Lower Mainland. Dr. Sarah Finlayson, a key champion, pictured on the slide with a quote, reported in August 2025 that for the first time in years, women in BC are receiving their cancer surgery on time. In July 2025, 90% of women had surgeries as scheduled. Premier Eby and Minister Josie Osborne have reaffirmed their commitment to further expansions, including Surrey. And while no timeline is set yet, planning is underway and we continue to monitor progress. As I mentioned earlier in this session, OCC will work in coalition when it makes sense and when health system issues impact more than one organization. We are members of the 4 coalitions listed on this slide. So first, the Best Medicines Coalition. This is a national alliance of patient organizations with a shared goal of equitable and consistent access for all Canadians to safe and effective medicines that improve patient outcomes. CanCertainty is the united voice of more than 35 Canadian patient groups, cancer health charities, and caregiver organizations working with oncologists and cancer care professionals to improve the affordability and accessibility of cancer treatment. The Quebec Cancer Coalition, so this is a group of more than 70 nonprofit organizations representing all types and phases of cancer from all regions of Quebec. Their aim is to improve public health policies for and with people affected by cancer. And then finally, Cancer Action Now. So this is the National Alliance of Patient Organizations, professional associations, and life science companies who are witnessing the magnitude of the problem our cancer care system and its patients are facing. So we bring your voices into our coalition work. For example, in September 2024, we wrote a chapter on ovarian cancer for the Quebec Cancer Coalition's draft recommendation report, which was on objectives and priorities by cancer type, which has since been shared with the Quebec Minister of Health's office. Also in April 2025, we had an ovarian cancer patient story included as part of Cancer Action Now's patient story series on their website. I will now turn to our upcoming advocacy priorities. So for research, we will continue to advocate for Nova Scotia to fund ovarian cancer research in the province. Prevention, we will continue to work with our Ovarian Cancer Prevention Task Force, which includes those with lived experience, researchers, and clinicians, and continue working with clinicians like genetic counselors and members of the GOC BRCA Plus Collaborative to advocate for healthcare systems that have the capacity and processes to support effective cascade genetic testing so that those at high risk of having an inherited genetic mutation that puts them at increased risk of ovarian cancer have timely access to genetic testing. And treatment access. So we are working to ensure that Canadians have access to biomarker tests like HRD testing and folate receptor alpha testing to help doctors and their patients determine the effectiveness of targeted therapies like PARP inhibitors and ELAHERE. We will also work on advocating for timely access to new treatments like ELAHERE and other emerging treatments. Thank you very much for attending this session. I want to encourage you once again to really get involved with OCC's programs. Attend TLTs, have a conversation with OCC staff or politician at the walk, post your questions and share your experiences on OV Dialogue, have a support call with our programs team, or sign up for our newsletter. These are really the best ways to engage. And thank you so much for having me.